Hello and welcome to the Baker Senior Show. I'm Marion LaSalle and this is Steve Baker. Good morning, good afternoon, good day. Whatever time you have to be watching this video, we're glad that you're here. Hey, Steve.
Hello. Glad to be here.
Me too. I'm glad. Every time we get together, I learn more about Medicare, which is, you would think it would be a simple thing. You get a Medicare card and you're good to go, right?
Right.
No, that's not how it works. There's so many details that you need to know about, and things are changing right now with COVID. So today we're going to be talking about Medicare Part B. We're going to find out more about what those premiums are and a little bit more details about what it means for us to have Part B. Do we have to have Part B? Is this optional? Is it cost money? There's a lot of details. So Steve, why don't you start off by telling us a little bit about the background about when you need to be on Medicare, when you need to start thinking about it, and when do you need to call you?
Okay. Great. Well, traditional Medicare and the more modern version of Medicare is over into the Advantage program. Medicare itself is broken down into 4 categories, as we've explained many times. Part A typically has, by the time you reach Medicare age or getting close to Medicare age, Part A is already taken care of. For as long as you've had 10 quarters of employment and have worked for someone for 10 years, that's 40 quarters, then you're definitely eligible for Part A. And the premiums for Part A have already been paid. And I've explained many times, that if you're employed somewhere, when you get your paycheck, they take out a little portion. There's a little square that says Medicare. That goes to A.
So wait a minute, Steve. So you keep saying what we've said before. So I want people to know that there are replays. And we cover a lot of different things about Medicare. Every Tuesday we're here. So if you would like, and we're not talking about the question that you have today, you can go back on YouTube and on Facebook and see all the replays. And the title is, gives away what we're talking about that day. So that's why Steve is saying, we've talked about A before, because we had to go over what A is. But today we're talking about Medicare B.
Exactly. Now B is the next category, and that's totally different from A, because B, once you qualify and get on it, then that's the medical part. A is the hospital part. B is the medical part, doctor's visits inside and outside of the hospital. Today, we're going to talk about the premiums, because I just explained that A is already taken care of from years back. You paid for A. But B, you need to pay premiums. And mostly, I'm going to say 70 to 75% of everyone is covered. The premium is covered, because if you had, and it's a 2-year look back on your income, if you're single and you've made $87,000 or less, then your premiums for 2020 would be $144.60. For a joint return, husband and wife, that number would be $174. So if you've made that amount, then your premiums are like $144.60. However, there's something that's called IRMA. It's called Income Related Monthly Adjustment.
IRMA.
IRMA. It's a name after they've made all the deductions and so forth. There's something that's called IRMA. And if your IRMA is like for a married couple, if it's up to $750,000 together, if you've earned, then you go into another category. Instead of your Part B premium being $144, the amount is $491. So after, and when you cross into that next territory, your premium goes up dramatically for Part B. So, that also transfers over to Part D. Those will go up proportionally as well. Your Part D premiums will go up as well.
Now, when you say premiums, is that an additional insurance, or is that strictly Medicare?
It's strictly Medicare. And typically, let's say you're on, when you become Medicare age, that's 65 or more. And typically by that time, you're receiving a Social Security check. And those Part B premiums are deducted out of your Social Security check, because people tell me all the time, oh, I don't pay any of that. And they don't realize, that their monthly Social Security check has been reduced by that amount. So it's kind of behind the curtain, so they really don't see it, and they don't even have the money, so it doesn't affect anything. So they just accept that and go on, but they are definitely paying that amount of money. So it goes all the way up to at $750,000. It could actually go up, if you're making $1 million or more or whatever. And people say, well, it's hard to get to that amount if you're on a salary. But let's say that you own some investment property and they pay you on a regular basis for the returns on that investment, and it builds up over the year, then that adds to your annual amount. And that's figured by the IRS, and the Social Security and the IRS kind of work in cahoots with each other. So they can check and go back 2 years and see what your income has been. And they will charge you for your Part B premium proportionately. So it's just a matter of staying on top of it and understanding. There are certain situations where your income goes up for, few years, more years, or whatever. You can have income changing events. In other words, you can be married and then all of a sudden you're divorced. And when you're divorced, then your income drops dramatically and you have to start filing separately. So that all has to be included. So you have to monitor that and make sure that your premiums will not suffer because of, you have to go back 2 years, remember, and you got a divorce last year, then you have to notify Social Security, then you have to send in documentations and so forth that your income has been reduced by half. Another situation is a spouse, you're not divorced, but your spouse has just stopped working. So now that income is not coming in. And Social Security will just go ahead and deduct the other premium. You have to be proactive and notify them that now our income, or my income, is not nearly what it was last year. And if you've got some investment property that you've sold, say just raw land or whatever it is, and I've seen this numbers of times with clients, is that last year their income showed $900,000, and this year it's $125,000. So there's a big difference. So that's a huge amount that that's you're in for, because they're going to go ahead and take that money out of your Social Security check, and before you know it, it's gone. So you have to be proactive and contact Social Security. This is a one-time annual event, and they, with documentations, they will absolutely follow that and make sure that that there's that there's no issue there. So that's and all of those things come into play. So Medicare over a period of time is just not set it and leave it alone. You have to monitor that through the years. So have any questions at this point?
I have a couple of statements that it really kind of makes your stomach go around, thinking about all the things you have to remember and think about when it comes to retiring or getting on Medicare. Turning 65 seems daunting. Thank God, and I really do mean this, that you are there to answer the questions. So I'm relieved also that when the time comes, because I'm 62, when the time comes for me to turn 65 and get on Medicare, that you will ask the questions that you need in order to get me the right benefits and the right, I don't, I hate to tell you this, but I don't want to memorize everything that you've told me about Medicare because
Right.
it's a lot. There's a
Right.
lot to it. And it makes me feel good that I can call you and you'll tell me, well, Marian, this is, your situation. And because of that, we need to do this. And because of this, we need to do that. And so I'm grateful for you.
Right.
Because you don't try to sell me something. You try to give me the best care possible when it comes to Medicare.
Uh-huh. Yeah, and a lot of it, that I talk with people about is not Medicare itself, although that's a big part of it, but it's all of these ancillary issues that's outside of your health care that can affect what you pay for the premium.
Yeah.
Another example would be property that's been destroyed by a tornado or hurricane, and I've had a few of those where people call me and say, my shopping center that I was invested in is no longer in existence. So what do I do? Because I'm not getting income from that. I will eventually probably get some insurance payments from it, but it's no longer there. So what am I going to do? And so we investigate and ask some questions and call the right people and so forth, and get their Part B premiums and their Part D premiums reduced dramatically.
That's good to know, because I don't think people realize that when you're on Medicare, it relies, or the amount that you pay depends on your income. I don't think I didn't know that, honestly. Right. And we've talked about Medicare for months now. And so these are the types of things that I'm just so grateful that you understand, that you know. And also, for those of you who are watching this live or on a replay, just know that you can get not only a free copy of the Medicare and You book by calling Steve at 832-754-3292, but you can also talk to him about upcoming Medicare, or let's say you're working at a corporation and you've been laid off, or you're getting ready to get laid off because of the COVID, and any problems that might arise as far as you getting on Medicare and choosing the right program for you. Is that what you call it, Steve? Program?
Uh-huh.
You can ask Steve and he'll let you know the best way for you to proceed, because he not only takes you in mind, he takes your work, he takes your income, he takes your spouse, he takes where you live. There's all these different things that are happening. There's Medicare, there's Medicare Advantage, there's all these different parts that play together, or they don't.
Yeah, exactly. And I've told people, for years that Medicare is not a set it and forget it program. You've always got to, stay right on top of it. A good example would be where we live in the lower Texas area. A lot of, as we're talking right now, COVID or pandemic or whatever you want to call that program that we're on now with all the masks and so forth, has just devastated a lot of industries in our area. One being a lot of oil companies and so forth. And, a company, a person rather would be just riding high, and they're earning large amounts of money on a regular basis. And all of a sudden, boom.
That fast.
And you see, I see in the business journals all the time that so-and-so company has cut back. They're going to lay off 5,000 people nationwide or worldwide. They're going to cut back 20,000 people or whatever. So all of those people with big incomes suddenly don't have big incomes. So they should not forget that that in Social Security is working with the IRS, and they're just going right along, just ticking right along. They don't investigate, so you don't take the opportunity to alarm them that your income has dropped. So that's that's a trigger that you have to pull. And to be honest, a lot of people, they have CPAs, they have financial advisors, they have, and a lot of those people are really up to speed on that sort of thing. And if you're a good CPA or a good financial advisor, you should tell the folks that their income has dropped dramatically and their Part B Medicare premiums need to go down dramatically as well. And they have to submit the proper documentation the year that it happens to make sure that that it happens. I mean, just 2 years goes by and you're still being charged the higher premiums. So most professionals working out there in the area are aware of that, and should be at least. But just to make sure, I would check with someone who's knowledgeable about Medicare, someone like me who can advise you about your premiums and so forth. So that's what that's what it's all about. And I've long since quit working on this. I do help people, which means I do sell a lot of Medicare, and I do help people a lot, but that's not my major thrust nowadays. So we're able to help people and guide them in the right directions and just make sure that everything is working and just moving right along. So that's, yeah, go ahead.
What is your major thrust?
Well, my major takeaway from this broadcast is that people just need to be aware, and they need to check with their professional advisor about where they are with their situation. And a lot of times they'll go to their CPA, and their CPA will tell them, that their income has been adjusted. So these are the ramifications of a major drop in income. And a lot of times the companies will give someone a package. In other words, that means that they will pay them for a certain amount of time, and their health care will continue for a certain amount of time, and so forth. But another thing, excuse me, that people need to be aware is that their health care situation changes too. So they need to check, particularly if they've worked past 65 and they're of age, and they should not have taken Part B yet. So we can evaluate their situation and tell them that even though there's a 2-year look back on their income, 2 years ago they were making dramatic amounts of money, but I can show them how to certify that this year they're not making but a third of that, or 20% of that, or whatever. So that needs to be taken into consideration, and Social Security and Medicare needs to be made aware of that.
It seems to me that each stage of our lives, that certain things need to be looked at and prepared for. So I'm not really sure why in the American lifestyle we seem to think, well, that's 20 years from now, I'm not going to worry about that. Or that's 30 or 40, 50 years from now, I'm not going to worry about that. I don't really understand that mentality, especially now that I'm 62 and people are starting to tell me, well, if you don't do this, they're going to, dock you. They're going to punish you. I'm like, what? No one told me that before. What are you talking about?
Right.
And so I don't know. The education of us here in the United States is on the wrong things. It's not always on, make money now, and worry about that later. Have you
Right.
noticed that?
Yes. Yes, I have.
Well, it shocked me last week. So for those of you who did not see last week's show, we talked to a lady who owns a personal care home. And we talked a little bit about the problems that people run into when they don't do something. But if you don't know you're supposed to do that, you didn't know you're going to get penalized. There's
Uh-huh.
fines and fees and penalties for not signing up for certain things in Medicare. Please don't let this happen to you. Call Steve 832-754-3292 and get the scoop about your situation, because it's different than your neighbors. It's different than your spouses, your friends at work. You can't go by what everybody else is doing. A lot of people do rely on their friends and their neighbors when they tell them things about their insurance, their Medicare, their health. It's not a one size fits all, and you really do need to talk to a professional. So, Steve, how much of your time is spent digging into what a person's situation is so that you can figure out exactly what they need?
I would say around 20%.
Mm-hmm.
And we spent most of this time on on this episode of our show talking about Part D. I'm sorry, Part B is in boy.
Yes.
But we also need to discuss Part D. That's the drug program.
That's very important
Yes.
because as you get older, you tend to get on more prescriptions to keep
Mm-hmm.
you healthy, and like blood pressure and thyroid. There's a lot of different medications that I notice as I'm getting older that everyone my age is on.
Right. Right. And a lot of people don't realize their prescriptions change, but also the plans change. The prescription plans change from year to year. In other words, one plan may be like this. It may, work in a way that's just fits. All of a sudden, the next, what's called AEP, and I'll explain the AEP in just a second, but the annual enrollment period all of a sudden changes for the next year. In other words, they decide that we're gonna do this with the drug program. We're not going to do this. We're going to take this, and we're not going to take that. So all of those Part D programs are changing every year, and it's during this period from October 15th through December 7th. It's called the annual enrollment period. Is a
Now,
period of
now wait a
time.
minute, because I was told it was open enrollment period. Is there a difference between annual and open?
Yes, there is.
Okay.
Open enrollment is quite different. In other words, it's open for that period of time, and that could be any time of the year, depending on your birthday, when you're signing up and so forth. But once
Oh.
you're signed up, there's called an annual enrollment period where you can actually, particularly for the drugs, almost everyone that has a Part D plan can check their prescriptions, and I'm more than happy to do that with anyone. Check their prescriptions to see if it will carry over for the next year. It may or may not. So your plan may be changing. So during that period of time, October 15th through December 7th, you can actually change your plan, your Part D plan. I'm talking about your drug plan, not the other parts of your Medicare, but you can actually change your Part D. And it's possible that you could have significant changes and significant savings if you change a plan, and you can easily do that. And I can talk to you and tell you how to do that. We can check your drugs and go on Medicare.gov, and I can show you how to check your drugs that you're on. And that may change in the last year, or it may be just exactly like you still need to check your Part D plan. And you can do that whether you're on traditional Medicare with a supplement and you have what we call a standalone drug plan. And by standalone drug plan, it's separated from the other parts of Medicare, or you're on a Medicare Advantage plan, and there are numbers of those that are out there. And you can also change that plan if you'd like to. And I can check that for you as well. And possibly we could find a much better plan for you that includes inside of it. It's actually included. It's not a standalone. It's included in the Medicare Advantage plan, and we can check that and see if you could get a much better situation set up for yourself. So, for sure, all people who are on Medicare Advantage need to take a look at their situation and see if they can get a better plan in their area. So I do that as well.
You see, you really need his phone number, 832-754-3292. And his website is bakerseniors.com. And so if you really need to talk to Steve and you've lost the phone number, you can go to bakerseniors.com, or right here on YouTube and or Facebook, we have the Baker Seniors information. So you can go just about anywhere and type in Steve Baker, and you'll see that you can get a hold of him, which is really great. A lot of times when we go to talk to somebody, a professional, they're not available. But you seem to always be available to answer questions. Even if it's not right away, you'll call them back right away as soon as you possibly can. You're very prompt and you're very thorough, and I really appreciate that. This
Correct.
has been quite an education for us, Steve. I know that you wouldn't think we would have a lot to talk about with just one plan, Plan B, but it has all these different legs, and it has all these different things that depend on other things in order to come up with the answer.
Right. Yeah. And it's one thing for someone to be on Medicare for a lot of years and be on a plan and just, like I said earlier, you can't just set it and forget it.
No.
So those people who are reaching an older age, for sure, can have a relative, a son or a daughter, or even a granddaughter, contact us, and so we can all work together and check and see if there could be a better plan. Maybe there won't be. Maybe the one that they have was going to work perfectly well. But it pays for everyone to go ahead and check those plans, and just to make sure, especially October 15th through December 7th. That's the period of time where you can do the best adjustment for yourself altogether.
Yes, I agree with that. And it's true, because every time we have something that comes up, I'll give you an example. I got a text from my pharmacy, and they wanted to give me 3 months of medication at one time to, I don't know, save them time, save me money. I'm not sure why they wanted to do that, but I thought, no, my doctor may change that. I need to keep up with it myself. I don't need to just, blanket, give me this for the rest of my life. No.
Right. Another thing that a lot of pharmacies do, they'll, if you're on a monthly plan, they will just go ahead at the end of the month, and they'll just go ahead and fill that plan, and then say, come by and pick up your prescription.
Yes.
Where for lots of reasons, you still got a good ample supply of that same medication that you're using. So I told my pharmacy just to take me off all of those auto renewals. They call them auto renewals, because they just renew it automatically. Yes. Without calling you or contacting you or whatever, if it's in effect, and make sure, they make sure that the doctor they'll call the doctor and see if this is still valid.
And
if it is, they'll just fill it, and before you know it, they'll say, your prescription's ready.
I know.
And I'm going, I didn't order.
Yeah.
I didn't order a prescription.
Same here.
So, so you have to, just can't just let it ride or set it and forget it. Just
I agree.
always be aware.
I agree. Just thank you for being here today. Thank you for sharing this with your friends, your neighbors, your business associates, and those people that you know are getting close to Medicare age. Please just share it. There's Facebook and LinkedIn and Twitter and word of mouth. Please share this with people because Steve is very, very capable of handling just about any circumstance that you may come up with. Just call 832-754-3292. Remember, we're here every Tuesday at 8 o'clock Central Time to answer your questions. Thank you, and we'll see you again next week. Bye for now.
Bye.